Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to Helping Seniors Television. On behalf of Joe Steckler, our president and founder, and our entire Helping Seniors team, thank you for joining us today. I'm Kerry Fink, and it's a pleasure to have you join us because I'm excited to introduce our guest today. Our guest is Kelly McDavid-Rallis, and she's with Home Health Care Resources Corporation. How you doing today, Kelly?
I'm great, Kerry. How are you? It's good to be back.
Yeah, we were just talking about this. We've had the pleasure of doing several television shows that I want to encourage you, viewer, if you've had a chance to take a look at the Helping Seniors YouTube channel or the Helping Seniors website, which is helpingseniorsofbrevard.org, you'll be able to find all of the television programs, the radio programs, and most of the Helping Seniors updates are also archived there. But we've had the chance to chat about this before, but with Home Health Care Resources Corporation, you really serve a very important need here in Brevard County of helping people get the right help they need at home. And so one of the things that we talked about, what we'd like to bring out today is how do you begin that conversation? Maybe you are an adult child of a senior and you're worried about mom or dad or another relative who's getting older and maybe needs a little bit more help and attention at home. Or perhaps you're the spouse of someone that you're realizing the job is getting a little bit overwhelming and you need some help. And so one of the things I asked Kelly, I said, could we talk about some ways to ease into home health care? And sure enough, you have sort of like 8 steps or things that we're going to cover today on Helping Seniors TV. Before we get that far, though, I want to ask you a question because I assume when people first start to get the idea that they need some help at home, they look for scenarios that may not necessarily be the best. By that, I mean, they may see a business card down at the local grocery store that says, I can help you at home, or maybe they saw a national ad or something like that. And while maybe the chances are that it could be okay, we also have done a lot of work on helping seniors about senior fraud, and that seems to be a place that sometimes all that can get mixed into the mess.
It can, and sometimes they can talk with someone and mention that they might need extra supports at home, and I know somebody that can help you, my neighbor. Mm-hmm. But there's a lot more intricacies that go into providing quality home care and making sure that your loved one is being protected and they're safe in their own home.
And not only that, though, there's another factor that we were talking about just before we started rolling the cameras, and that's the fact that not all agencies are created equal in terms of having a focus for seniors. Like you might call somebody and they might say, oh yeah, we can get some help over there, but it might be somebody who's not used to working with seniors. And there's a lot of issues that come up even on that level.
There are, because there are private duty and there are skilled care. So there's skilled care that is covered by Medicare, mm-hmm. and there's private duty home care that's covered by long-term care insurance. Mm-hmm. There is private pay options that make it super affordable. And there's also long-term care Medicaid that can help cover the need for home care services. And home care services is very different than someone who may need physical therapy, occupational therapy, speech therapy, due to maybe they had a fall and they were admitted to the hospital. Mm-hmm. They may have had a car accident, mm-hmm. and they're needing additional supports while they're healing and recovering, or they had a massive spine or back surgery, mm-hmm. and they just need some additional care. Right now, because we are being extra cautious with infections and viral things and influenzas and even the COVID, mm-hmm. we are seeing an influx in patients who are receiving care in their home.
Yes.
They're limited their exposure into a facility, and maybe they're opting not to go into a skilled nursing facility to have that skilled rehab care, such as the physical therapy. They can have a skilled home care agency come into their home to provide those services. And with those services, they can also send a home health aide to provide bath services. We are a little different, but we also work with those skilled agencies to provide home health care aides for continuity. So if someone's provided with home care services like homemaking, respite, personal care, companion, shopping, and they also have a need to receive the skilled service, we can use our same home health care aide to help with the baths with continuity, because we also are connected to my staffing resources.
Okay. So that was a question that I wanted to ask you. If we're sort of new to this whole idea that this is, if we kind of zoom back out, we're just thinking like, wow, we know what we're doing is getting a little bit stressful, or it's not working, or it's not maybe even safe anymore, and we're going to have to take a step. What are the things that somebody might call you guys at Home Healthcare Resources Corporation? What are the kind of things that you would say, if this is what you're thinking about, this is when you should give us a call?
Well, it may not even be a limitation issue where a person needing services has limitations. They just may want some extra support. A lot of people use housekeepers. They use a housekeeping service. Mm-hmm. But as you age, and we're working to support the age in place movement, right, we want to make sure that we're using someone who is background screened. Mm-hmm. They are verified in the National Sex Offender to be sex offender free. Mm-hmm. We also verify someone's driver's license and make sure it's valid, whether they take someone to the doctor or go grocery shopping for them. We want to make sure that they have a clean driving record, because it shows ethics and character in someone. So there's a lot of different things that we're looking for when we're making sure that we're onboarding and we're hiring home health aides and certified nursing assistants, because we do require 75 hours of training plus additional annual in-services, as well as every 2 years they must keep their continuing education credits active and updated. CPR, first aid, auto insurance, everything has to be updated for us. They also have to have annually a physical completed to show that they have no limitations or restrictions to help a senior. Mm-hmm. And also if they've had the tuberculosis testing. Wow. To make sure they're free from any kind of communicable diseases as well.
So there's really a lot that goes into this. And the problem with when you see that name tacked to a corner of a bulletin board, maybe, at church or, in a shopping center or something like that.
Library.
The library. The challenge is you just really don't know, because there hasn't been that kind of vetting out of who is coming into your home. And for those of you that may have paid attention to some of the things that we have posted, one of the tools that we post quite frequently comes from our state attorney's office, where they send out a newsletter monthly and they talk about scams that are affecting seniors. And so while a lot of these are online, one of the things that we have learned over and over is sometimes the biggest fraud and activities happen right inside the person's home because of somebody that they thought they might be able to trust. And so one of the benefits when somebody calls an organization like yours, where you have done the homework, you have checked everything out, you know what's going on, then that gives them a peace of mind that they otherwise might have to wait a long time to see what it's all about.
We really focus on continuity of care. So we want to find the right fit. So our software system allows for caregiver and client matching. Oh. So whether they have a pet, maybe they smoke in their home, maybe they speak a different language, maybe they prefer female caregivers over a male caregiver. There's a lot of different components that we enter into our software system as far as patient preference and also caregiver preference. And we put a match together. Also demographically, we don't want to send a caregiver who may be amazing, but we don't want to have them go 3 times a week and they drive an hour away.
Right. So
we're looking for a long-term fit. We're looking for whether it be, 1 time a week, it may be 3 times a week. It could be even 24 hours, 7 days a week around the clock care, because right now we are doing everything we can do to keep people in their homes. People feel safer. They want to know that we're utilizing precautions, that we're wearing masks. We have personal protective equipment that's being utilized and supplied by the caregiver, and that we are also testing for any kind of symptoms or illness. It's funny because I have to go check in on a client this afternoon, and even I get a little notification for our software. Do you have a fever? Are you experiencing shortness of breath? Do you have fever, chills? I have to literally answer those questions. And if I were to answer yes to any of them, an alert is sent out and I am pulled from that schedule until I would get a negative test result.
You know, and that is such another important part of it, is because you guys are so stringent about making sure that you're keeping not only, you know, it's not only keeping the patients and the folks at home safe that you're talking about, but it's keeping the caregivers safe as well. It's just showing good responsibility all the way around. And as we've talked about, folks, that Kelly has such a background. We've almost joked about it, but you've been doing this since you were a candy striper as like 12 years old.
Absolutely.
So this is your life. You know this, and you take the care of seniors, very seriously and responsibly. And you know, that's one of the things that I think people get a sense of. If they talk to somebody, they can tell if somebody is in it for the right reasons. And so the thing that you talk about going out of your way to make sure you're finding the best possible match is important. And you raised an important point. You said, during like COVID times, people's routines had shifted around and things were kind of a little bit more fluid, but you would encourage people, say, no, stay on the service with the people that you know, because there's an advantage to that stability. And I was just going to get you to maybe comment a little bit about that.
There really is. There's a trust that happens. You have someone in your home that may live alone and that maybe have family out of town. So how do you know that that person is providing quality care and they're safe with your loved one in their home?
Right.
And we're keeping things respectable, and we are honoring the services that someone has elected to receive. And we really want to have that rapport. It's so amazing that we use technology and advancements as much as we can. So for instance, our family members, they text us. They can call us, they can email us, they can ask us questions, they can keep us involved. We can do video chats with them, with the caregiver present in the home, so that if they have any questions or concerns, that we can be there to answer them and help to provide proper guidance. If we have a situation where we're noticing a change in condition in someone, that's another reason, and the most important reason, to have that continuity of care and trying to work with us to keep the same caregiver in the home, and always have a backup for emergencies, because we never want anyone to be without care. Right. But the biggest thing is that as you get to know someone, you learn their behaviors or mannerisms. You learn what's right for them. If they have extra weakness one day, their thought process is not clear. Maybe you're seeing an increase in their Alzheimer's or dementia symptoms, or they're having low blood sugar, they're not ambulating as well, they're walking a little slower, they're leaning to one side, if they're in a wheelchair. Those are things that someone who has the relationship with the client or patient, they're going to be able to pick up on any kind of changes and report it to the agency.
That, and everything you're saying is so important, and that's why it makes so much sense to have that connection with an organization like yours, because I was thinking, like, particularly where we live on Brevard County, we call it the Space Coast of Florida because we get to launch the rockets from here. But, there's so many people who say, well, I'm from up north, but I really want to retire to the sunshine. So we find out there's a lot of adult children of parents who've retired to Florida, and they may be, in the Northeast or the Northwest or some other place, and they like to fly in a couple of times a year and see how mom and dad are doing, or whatever the case may be. But you then really become an extension of the family, because you're able to kind of step in when they're not able to be here, and particularly when there's something that goes on like a COVID lockdown where you just can't be there. You have the ability to keep that continuity of things moving safely for the seniors.
First and foremost, is about assisting with activities daily living, but it's also about adding quality to someone's life. If you're not adding value, if you're not enhancing the quality, then are we really living?
Right.
And because we are living much longer, our senior population is thriving, and we are aging in place. What is it that we need to be looking for in an agency to bring in those in-home supports, and not just using just someone because they have a business license for a specific service? How do we hone in on that craft and that specialized care that you're going to get with someone that has an extensive background in caring for seniors? And it also takes a lot of pride in making sure that we're hiring quality caregivers, not just quantity.
Right. And that is probably a good mode for us to shift into, because we promised, and I do want to cover the 8 ways to ease into home care for seniors. So maybe, like we talked about at the opening of the show, you know, we're starting to have a conversation. We're starting to understand that it's time to get some help. But I'm sure that initially there's probably some resistance. You know, I got this thing. You know, we're proud people, and we don't want to admit necessarily we may need the help. Number 2, we're maybe embarrassed that we need to have some help. Maybe we don't like the way our house looks inside. We don't want people to come in and see how we really live. You know, all those things, I'm sure, are factors. But the first tip that you wrote here, I'll get you to expand on it. You said, start slowly and allow time to get used to the idea.
Well, you want to mention it and discuss it with your loved one as an idea, as a suggestion. Like, wouldn't this be really great to have someone who can kind of come in and maybe help you do laundry and help you change your linens on your bed?
Right.
You know, right now because of the COVID, and you can do Instacart and all these other services that by the time you pay for that, you could have had our service and you know, home care services and additional services that go along with it for the same price. So how do you make recommendations? It is not pointing out the deficiencies or the inability to accomplish certain daily tasks with your loved one. You never want to make them feel like, hey, you're getting old, or you can't do this anymore, mom or dad. Like, we've got to get you help. Never make them aware that they can't do something anymore. Don't take their dignity from them.
You know, that's such good advice, because it also plays directly into your second point here, where you say, listen to the older adults' fears and reasons that they don't want in-home care, instead of just shutting down the objections right away. You
know, I had a client who I have for a lot of hours every week, because she has a great need. And she has some challenges getting out of bed in the morning, and she's a little obstinate with wanting a triangle, a Hoyer, different devices that can assist her. And I even mentioned an adjustable base that you can get for your mattress nowadays. But she explained to me that the bed that she had, she didn't want to lose her headboard because it was the one piece that her and her husband of 35 years shared together.
Sure.
So you have to have a relationship, and don't push your ideas or suggestions onto them, but do it with kindness and compassion to show them that this is something that could be helpful to you, not a replacement or a demand that you must do this. You know, most of our seniors are able to make their own decisions, and we want to respect that. And we need to have empathy and understanding, and their resistance may be very well justified, and we need to be respectful.
You know, and that's actually your third point. You write, help them retain dignity. And, you know, isn't that one of the most, I guess, most core principles, is like everybody likes to maintain dignity, even in difficult situations, I think.
Well, you know, our caregivers are trained. They have specific ways of making a bed. You know, they may have those hospital corners that they're trained with. But you know what? Our clients, our patients, may have a certain way that they like things done. And we're in their home, and they're where to assist them. We do have guidelines that we have to do. We have protocols. We do have a registered nurse that goes out and supervises the caregivers. So we do supervisory visits. We also establish what's called an aid plan of care. So the nurse is the clinical body that goes out and designates the services that are to be performed. Okay. So as long as we are providing those per the clinical aspect of the clinician, and also safety-wise, we can still work with the individual and kind of make sure that we're placing things in their reach, and so that we're not moving things and getting them confused, and we're not uprooting their lifestyle or their home environment. We are a guest in their home, and we want to provide safety and services, and we want to work with them. And to teach us a certain way that they like things done, and we'll definitely work that. We're not going to prepare a meal that maybe you don't like the food or you have a food allergy. So if you don't want liver and beets, we don't prepare that. We look at your nutritional needs, and we look at the things that you have within your home. If we're going to prepare breakfast or lunch, and we ask you, what would you like today?
That's good. That's good. So here's another recommendation that you put down on this list of 8. You said you could recommend personal care if the older adult is nearing the end. Maybe they're already having some physical, occupational, or respiratory therapy because maybe I guess they came from a hospital visit or something like that. So they're already maybe now somewhat getting used to somebody coming in every so often and helping a little bit.
They are, and that's a great way to start it, and also look at and piggyback on the care. Yeah. So if they have a skilled care with a service that is, by a licensed clinician, like the physical therapist is coming in and providing that. But now we realize, they're not able to even clean their home. They're not able to, do their laundry or even have those meals prepped. And we can work in conjunction with a physical therapist to make sure that they're, doing their exercises. They're doing things that are ambulating with safety, with assistance, with transfer board, using their walker, using a wheelchair, and then including them, putting them in the same room. So if you're folding their laundry and you're preparing their meal, you have them right next to you. You're not making them feel alone. Right.
And that's an important part of this. And, that moves us down to the number 5, which you say, maybe a way to approach this is suggest housekeeping support as an idea to help them keep their home sanitized. That's all we hear about, certainly during times of infectious outbreaks and things like that. Let's keep things clean. And, as we get older, it's tougher to bend down and get those things off of the floor or clean those spaces. Maybe that's a good way to open into it.
And keeping the air clean and sanitized, making sure, hey, do they need their air filters changed? Do we need to dust the ceiling fans? Are there, their little Hummel figurines or their collectibles that they have that their cabinets that they want to maintain and keep free of dust so they're not inhaling those particles. Right. So those are the little things that we can do, and it's a great way to start and implement and introduce home care services. And then once the relationship is established and they're trusting the home health aide or CNA, and then they can realize, maybe I do need assistance with my showers, twice a week, because I'm not as stable, as sturdy as I used to be. Making sure that they have a shower chair and they have grab bars. So I go in the home as well during the initial consultation to complete a safety assessment. I want to know if there's trip hazards, if there's too many electrical extension cords plugged into outlets. Are there bath rugs or even area rugs that don't have the non-slip backing? Yeah. And so if they could lose their footing and to reduce the fall risk.
Yeah. No, it makes so much sense. It makes so much sense. The 6th thing that you mentioned, I like this one because this is very practical. It says, offer to cover the cost or split the cost amongst family members. You already made a case, and it makes sense that probably for what you might be spending on Instacart, when you start figuring out all of the costs attached to that, you may be able to find this is a whole lot more affordable than maybe you were afraid it was.
Well, that's the biggest issue is that people have probably, I don't know that I can put it in my fixed income or in my budget. How do I make that work? Maybe you haven't, downsized your home yet so that you can have more financial affordability to age in place. Maybe that's a plan that you're planning on in the next year or the year to come. And I know Helping Seniors of Brevard actually has some great connections to those senior relocation specialists and those who are professional downsizers for seniors. This is something that can be done in conjunction with a home health care organization. Because we're looking at affordability, and also we're assessing through learning about their daily challenges or the family's desires. How do we connect them to services that are the most useful? So that way we're not overextending a budget where they can't afford services, because then after maybe 2 months they realize this is out of my budget. I don't have the income that can sustain these services. Right. So maybe a family member if there's 3 children, maybe we can look at with mom or dad's supplement as well. How do we break this up and make this and get the most hours so that we're going to identify what services are needed. Then we're going to work with a budget and determine how to get the most services that they can benefit from at the most affordable cost.
Makes sense. Number 7, introduce the aide as a caregiver and explain they're there to help.
We want to make sure that they know that they're not there to take over. Yeah. They're there to provide supports. We're not an intrusion in their home. We are a visitor. We're a guest. Yeah. And we're there to be an extension of those services in need. Sometimes the client or patient doesn't want the caregiver to wear scrubs. We make sure that they're wearing appropriate clothing, their protective footwear, those type of things, because maybe they've spent a lot of time in a hospital and they don't want a clinical dressed person in their home. They want more of a friend.
They want to feel home.
Yeah, they want to feel home and they want to feel like, hey, I've got a friend coming. But wow, you do develop a relationship and a friendship. But what a great way to know that they've also been background checked and screened and they have a lot of training and experience and there's someone behind the scenes making sure that they're providing quality services and not just someone who has good intentions, because sometimes good intentions aren't the safest way to provide the care.
Absolutely. And number 8 is really, it stands by itself, and then I'm going to ask you to give the phone number, but I love number 8. Tell them to start with, it's a temporary arrangement, trial period. You don't have to make a long-term commitment, and you can adjust as you go along. And that's the way I understand that you guys work anyway. So we just have a few moments left, but I want to get you to give that phone number. So how do people get in touch with you at Home Healthcare Resources?
We have an office phone number that is 321-677-2577. Our office number again is 321-677-2577. You can also send an inquiry through our website at homehealthcrc.com. And if you are a family member watching and you want to send an email, I can also mail out brochures, additional content, share our licensing information at Kelly, K-E-L-O-Y, at homehealthcrc.com.
Well, thank you, Kelly, and thank you, viewer, for joining us today for Helping Seniors TV.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.